So obviously co-production is around an approach of bringing in patients and carers and parents into that, so we can create better services that truly meet the needs of our community. Also adding in professionals to make sure that we get all views and perspectives involved in our service development and design to ensure that it meets everyone's perspective. So as part of the co-production team, we recruit experts by experience into the provider collaborative. They're supported, trained to do that role, and they come into the provider collaborative on getting paid on a bank contract. And basically what that means is they get involved in our service design. They use their lived experience to influence our services to ensure that services are suitable and compassionate and kind of understanding about the perspective from parents and carers to CYP themselves.
I joined because I really wanted to make a difference. My expert by experience background is that I had a daughter who was in inpatient tier 4 CAMHS care, and I recognised that even though I had what I thought was a lot of extensive clinical experience, when it came to actually having my own child as an inpatient and in a setting that I was not familiar with, mental health is so different from physical health systems. I was out of my depth, and I was acutely aware that actually there are lots of people who feel similarly about how hard it is to be a parent, and how my understanding is that unless we work together as service users and service providers, we won't get the balance right and have good results.
I would say EBs advise and provide that solid feedback around how it feels to be in an inpatient mental health service, how we can make mental health services better. So there's currently lots of projects that we're currently delivering as a co-production team, and we've got experts by experience involved in them, and the work and the impact that they have is so valuable on our services, and truly make sure that services are focused on those that they're there to serve.
There is a huge variety of positions that you can work as an expert by experience, and I've certainly found that for me the team that supports you are very appreciative of your lived experience, and that you can get involved as much or as little as you want. For me, I feel passionate about the fact that I want to make a better future and better outcomes, not necessarily for my children, but certainly for my grandchildren and other future children as well that are going through a very difficult time.
I think where we want to be as a provider collaborative is where we're using a full co-production approach across the PC, where children and young people have a part in service design and delivery and evaluation. We really want to be at that point. We also want experts by experience to have leadership positions in the PC to be able to advise and take them leadership roles in projects and new services that we do. We really want to get to the point where we've got more experts by experience involved across the whole PC in every aspect of it. And I think that would be the long-term goal, really, is get to the point. There's also another part of it as well around co-production, is that we'd really like to see more co-production not just happen at that service development level or that service design level, but also at that level in patient care. When the nurse is coming and doing the care plan, we want that to be co-produced with patients, because if it's co-produced, patients are more likely to comply with it, to follow it, and the plan's more likely to be successful as well when we actually work in partnership. We know that, through the history of co-production, that doctor and patient relationships and partnerships have always been taught as really, really important things, and I guess that would be another part of the long-term goal as well as a PC, is actually aiding more co-production to happen with clinical teams, and not just with children and young people, but also with their parents as well, to be able to co-produce a plan, to be able to co-produce a discharge plan that works and avoids someone coming back into hospital.